I understand you recently had surgery performed from Dr. Barrett.
Yes.
Is that correct? So could you explain the diagnosis of your condition?
Certainly. I was 57 and I had difficulty in doing just the day-to-day things like tying your shoelaces and crossing your legs and going up steps. And I came to see Dr. Barrett, took some x-rays, and told me I had severe osteoarthritis and it was bone on bone.
But what was the real catalyst for you to decide to go ahead?
It was twofold. I saw Dr. Barrett and he took time to answer my questions about whether I was a candidate for an anterior total hip replacement or a posterior one. And after about an hour and a half, and he was very kind, really focused on me and what my needs, are and were and what my goals were. He said, Betsy, in the final analysis, it's your body and it's your quality of life. And I'll always be here if you want to come back again, if you have any more questions. I've written a booklet. There are a multitude of other questions with answers in there. But, just feel free to decide what's best for you and your quality of life. And as I walked outside and was leaning on every car in the parking lot and setting off numerous car alarms, and then tried to sit in my vehicle and had to raise my legs, in with my hands, I thought, what am I trying to pull? I really need assistance. Anyway, called from the parking lot and said, I really would like to discuss having surgery now. So since having the surgery, it's been pretty miraculous. I've been able to walk free without any pain. Let's say 3 hours after the surgical procedure, I was up and walking in physical therapy. Within 2 weeks I was walking a mile and haven't stopped. And 4 months later I had my second anterior total hip replacement.
So your first one was the right or left?
It was the left.
Okay.
And it was in April, and then in August I had the right one.
Wow.
And same miraculous recovery within a few weeks, up and walking, and walked 6 miles in 6 weeks after the second surgery, and we went to Europe and we hiked, and we've been traveling the world ever since, thanks to Dr. Barrett and his phenomenal surgical team, and just exceeding my high expectations. Seriously, free from pain. I have not had a moment's bit of any type of discomfort.
Do you forget sometimes you've even had surgery?
I do, and I have to tell you, particularly on the Tour de Mont Blanc, there were quite a few doctors along just who, were hiking with us. It was a very small group. And when my loving husband of 36 years, Jeff, informed me that I had had 2 anterior total hip replacements, they stopped hiking and they went, no, that's impossible, because they just couldn't fathom me doing all of this without, being in discomfort or even being able to, raise my leg as much. On my way to have the surgery, I tried to put my knees together and touch my ankles and wasn't able to do that. I mean, something so simple. And when I went in for my checkup with Dr. Barrett, 3-year checkup, he was telling me how perfectly aligned everything is, how healthy the bone growth is. This is how it's always supposed to look. And, and I shared with him some of the places we had been to. And I was just really happy that he was so happy. Things have been great. And I swim a mile every day and try to do 6 miles of walking every day, because each day is a gift where I'm free from pain. And I'm telling you, I have a quality of life now that, many people, including myself, could only dream of, and being able to do what I can do. And thanks to Dr. Barrett and the surgical team, it's just pretty miraculous. It was just a really wonderful experience. And I like to tell anyone who happens to be viewing this that if they have any doubts in their mind whether or not surgery would be a good alternative for them in terms of a way of life and to enhance the quality of their life, I would really hope that they would investigate coming to Dr. Barrett because it did meet and exceed my expectations, and I have very high standards. So.